I'm here with Krista, and we're going to do a mini mentorship session. Krista, tell me, where your practice is, when you opened, all about your practice, who you serve.
Sure. My name is Krista. I'm a nurse practitioner in Connecticut. I actually just had my ribbon cutting today. Um, so I've been like talking to some clients, but I wouldn't say I'm officially open. So today is when I officially open. So I graduated in December and I decided to jump right in because where I work, the jobs are so limited because I'm locked in with the benefits and everything. And I figured like I could potentially be waiting years
Yeah.
to get a job within the system that I'm at. So I said, this is something that I've always wanted to do. So I'm just going to do it. Um, and everything kind of aligned itself. I'm like right next door to a therapy practice. It just like it couldn't have been better, but it's very slow and I'm trying to be patient and trust the process. Um, but it's been slow.
Yeah. Yeah.
Yeah.
Good. Yeah, it's really interesting that you say, like you're kind of making a job that you couldn't have access to. I think a lot of people when they give this advice of like, oh, get experience before, opening a practice. The thing is there's a lot of people that like, there's no jobs near them. They have to create the job, right?
Right.
Like you can't drive to a clinic, a bunch
New
of
York
clinics, a bunch
City.
of like clinics that you could get jobs at, near you. And so sometimes you just have to create the job. And I think that that's perfectly reasonable. I think most people would do that. And so
Yeah.
that's awesome. That's awesome. So you are right next to a therapy practice, so you have a brick and mortar, you're doing in person. Beautiful. Okay, okay, cool. And then, so your challenges right now is kind of like, how wondering how quickly you should start to see patients and how to get patients. Yeah.
Right.
Um,
Right.
it's interesting because, cash, you're taking cash, right?
Yeah. So within the last week, I decided to join Headway.
Okay.
I was trying to give it a chance, but I don't think I gave it a good enough chance to see how the cash would do. But also in this area, I knew it would be tough. I knew it would be a challenge. I also signed up with Reimbursify, which is, I think, great, but
Yeah.
it's so much of a learning curve for
Yep.
people who are not used to, they've never heard of out-of-network benefits. So it's a lot, it's a lot of like explaining how it works. And they're like, oh no, that just sounds too complicated. Um,
Yeah, yeah. It's interesting. Yeah, like not everybody knows, if you have a PPO, you have out of network benefits. You got to find out what your uh deductible is and then how much they cover after that. And you have to send in the super bills and then they send you checks. But, some people are willing to do that because they haven't found a good provider and some people aren't, you know.
yeah. So I decided to join Headway just for the billing and insurance piece. Still kind of keep that cash window open and just reevaluate and see how it goes.
Yeah. Yeah, yeah. With cash, I think, it's you giving it a good go is usually like 3 to 6 months, which feels like a really long time. And oftentimes, you want to have another job on the side to cover your basic needs because it is slow. And then with cash, I think a lot of it is maximizing your state, like there's probably areas not just near you. It's good that you have a brick and mortar because some people are going to really love that they can come in person to see you, but just there's going to be different areas all over your state and networking with people that also take cash, I think is going to be the key.
Um,
So, do you want to talk about cash or do you want to talk about insurance?
Cash.
Cash? Yeah, yeah.
Yeah.
Yeah. Yeah, let's talk about it. So, with cash marketing. So I think what has helped me the most, and just so you know, like how my startup was, like my first month I had 2 patients. Actually, no, I was open for 2 months and just marketed myself for 2 months, no patients.
Okay.
Then I like opened Um, that month I had 2 patients. The next month, maybe I had like 1 or 2. And the first 6 months, I had like 1 or 2 people each month. Whereas I think that in insurance-based practices, they're more used to people like busting down their doors and wanting to see them. Um, but cash, it's going to be slow and people are going to come to you looking for specific things. It also depends on like what you specialize in. What you specialize in, and that, are they looking, maybe they've seen other people that haven't like spent time with them, are they looking for someone that spends more time? Are they looking for, that's often kind of what is the benefit of cash is you can spend whatever amount of time you're not dictated by the time constraints of insurance where you're only paid a certain amount. And so it doesn't make sense to see someone for an hour, for a follow-up. Um, and then patients might come to you because you have like a specific specialty. I talk a lot about niche and kind of like the, that you're going to, people are seeking you out because you do something specific.
Mhm.
Do you feel like you have something that patients would specifically want to see?
I would say no, and I'm like anxiety, depression. And
Great.
I don't know, is that like narrow enough?
You probably want to be a little more narrow. Anxiety and depression is a great start. Is there anything like, do you do psychotherapy? Do you do like, a combination of like lifestyle and, or do you see like a certain type of person? Um,
I've been really trying to think about that, and honestly, like I put it on the back burner because all I've heard, over the last few months is build it and they will come. There's such a need that, like, in my mind, I'm like, being a psych nurse practitioner, that's me being in a niche all on its own. So like now I have to like really consider that. Something I would love to get into at some point is like the whole perinatal um, mood stuff at
yep.
some point. Um, that's down the line once I can kind of, see where things are going. But I think that will be my area.
That's great because that's really specific because like if you think of, okay, I'm a patient that's looking for a mental health provider, like what's going to differentiate you from other people? One thing that could help is if you are the only person in your area, right? Like if there's a need and you're the only person in your area, they will come. That is true, but they have to know that you exist. And so we'll talk about network marketing too to get people to know that you are open and that you exist. Um, and so when patients are looking, they telehealth gives a lot of access. So they're going to look at people, maybe in New Haven and, just like anywhere they probably could see people. So a patient might say, okay, I am a woman in my 30s with intense depression. And you look at a bunch of practices. And so the practices I think that might not like draw someone in as someone that lists out like every diagnosis possible. Then they're kind of like, I could be seen if they take my insurance, I'll go there. Cool. But what draws someone to see cash is if they're like, I don't care if this is like assuming they have the resources.
Mhm.
Assuming I'm a person that has resources, and like a good, like a solid income that could support seeing someone cash. So like upper middle, kind of world. Then I would say you want a patient to say, I don't care if they take my insurance or not, I have to see this person. That's what like draws them. So that's why I think niching is important. And if you're wanting to get into perinatal stuff, maybe you could target your practice to like women's mental health. And so
Mhm.
you're drawn, and you all over your website you talk about like the experience of a depressed and anxious woman.
Mhm.
So, like society asks you to perform well in your job, but you just like get up and you feel dread every morning, or on your lunch breaks you're taking a break and then you're having panic attacks on your lunch break instead of enjoying yourself. Like kind of the you see this like working, anxious and depressed woman. I say working probably because if they have the resources to pay for cash, they're probably
Mm.
working, right? Um, or stay or like working as a homemaker too. If homemaker is the right term, I want to, but I want to say like if they're working in that and they're like depressed and anxious while they're trying to love and like take care of their children. They're taking care of someone when they're struggling to take care of themselves, like maybe talking about that experience. And so if your website just like screams to them, like, oh my God, I have to see this person, that's what's going to pull a person to pay cash. Um, that's one piece. The other piece is if you take insurance, um, you're pretty much like that alone is like, I guess, quote, a niche because the person that's like a person that's like, I need mental health care. Maybe they have resources money wise, maybe they don't. But regardless, they're like, this is my insurance. I really need care. I want to see someone that's going to listen to me,
Mm.
but the main focus is do they take my insurance because that's the resource that I have.
Yeah.
That's kind of like it's a little bit broader. There's a lot more people that are going to have insurance and the resource of having insurance.
True.
So they still have to also know you exist too. Like I know that Headway says that they do a lot of marketing for you. Not a lot of people have said they've have people busting down their doors from just Headway. But regardless whether cash or not, the encouraging thing is so someone in my program, she's taking cash. She was open for about 6 months. She had about like 20 to 30 patients and she said, I want to double my patient load. And I'm like, well, you might need to take insurance if you want to just like boom, double it like that. So what she
Mhm.
did was she took one insurance. So I don't know how far you've gotten with Headway, but you could consider if you want to mostly take cash, you could take just like one insurance and then anyone else that wants to see you is cash. How does Headway work? Do they make you do like kind of their full panel? Like I know it's like two or three, or could you just pick like one?
There's like four or five
Mhm.
bigger names. I don't know that I had a choice.
Oh, okay. Yeah, it's just like do it or not. Yeah.
Yeah, because
Yeah.
another girl that graduated with us, she did it too. And so she is in Long Island in the Hamptons. So
Yeah.
she is
Wow.
busy. She's about to quit her full-time job. But she gets referrals through Headway. Like Headway is working the way it should for her,
It's working. Okay. Yeah. Yeah.
working for her. Um, I'll just see where it goes with the few insurances and then the cash and then go from there.
Yeah. Yeah.
Yeah.
So I think at this point where you're at right now, I think the strongest thing that's going to help you is network marketing.
Okay.
Talk me through people that have called you. Um, where are they coming from? How do they know you? How'd they find you?
So there's been a few that have contacted me from the therapist office.
Wonderful.
So I have like a referral form that I make, and so we make referrals that way. I just looked at one from Practice Q. She said she found me on Google. So I'm like, okay, that sort of works.
Good.
One from somebody I know, she knew someone.
Good.
I also have to get comfortable letting people around me know that this is what I'm doing because I feel like I'm so like secretive
Yeah.
about it. Um, how else? I think a couple more Google. Yeah,
Good. Good. Okay, that's positive. So you're showing up on Google.
yeah,
Um, you might ask people like a little more detailed, like, oh, did you Google just like mental health near me? Was it because my office was close to you? Like kind of figure out like
okay,
how. And then the benefit of having like a couple of referrals is you can like dig and kind of like then get more that way.
okay.
Um, so we'll talk about that and then we'll talk about the phone calls and how those went. So this is great. So you have had people call you, the therapist office, people that you know. Yeah, so I'd say like that's network marketing. It's like do more of what you're doing. So let people know. Someone in my program was really exciting. She said her first client was from someone that knew her massage therapist. Like she told her massage therapist what she does for a living, and then her massage therapist gave her name to someone else. Like you just never know, like if you just talk to anybody, people at the
Yeah.
grocery store. Do you live in a smaller community? Is it pretty, or is it a bigger city?
It's one of the bigger cities, I would say, in Connecticut, but all the cities here are small. But it's one of the bigger cities for Connecticut. Yeah.
Okay. That's good. I feel like, in Los Angeles, if I talk to the person at the grocery store, that's good because my practice is like near my house. But sometimes people in bigger cities, like it's not as powerful because there's so many people. But if you're in a smaller area, then if you talk to someone at the grocery store, it's like you're the only psych person in town. So that can be really great. But so just talking about what you're doing to everybody. And then the therapist office sounds like a winner.
Mhm.
So
Like we're door to door. And
that's
I've known
so good.
her for before I was even a nurse. So like, I don't know,
Oh,
12, 14 years.
oh,
Um, and so she kind of like, and really encouraged me to do this. So that's been really, really good. Yeah.
okay. She's probably going to be your best bet. So maybe, so she knows. Actually, let me ask, does she take cash or insurance?
Insurance.
Okay, good. That's good. Like when your strongest referral source is the same payment type as you. Like all of
Mm,
the therapists that send patients to me, they all take cash.
okay.
Um, because when I was networking with people that took insurance, they were like, it wasn't hitting. They were like, why don't you take insurance? My therapist takes my insurance. Why don't you? Um, so as long as it's the same, so maybe get with her and see, make sure it's the same type of insurance that you're getting through Headway. And you can say, send these specific clients over to me that take the same insurance. And
Okay.
then you might want to talk to her about all of her therapist friends in the area. Visit their offices, take them coffee, talk to them about what type of patients they see. Say that I think something that's really helpful when you're working with therapists is telling them, I like my patients to be in therapy, so I'll refer to you. Not just like send your patients to me, but also, it's going to be like this is going to be a beneficial both ways.
Mhm,
So
mhm.
maybe if you get with your friend and kind of find out all of her therapist friends in the area, meet them, tell them that you exist, have Zoom coffee or visit their offices. You can do that with anyone she knows. And then you even could hop on Psychology Today, write to anybody that's close to you, do the same thing, Zoom coffee. I think it's just letting people know
Yeah.
that you're there because
Yeah.
sometimes newer businesses don't show up on Google,
Yeah.
when they first are looking for you.
Yeah. I had all these packets put together with my referral forms. And the plan was to just pop into a few offices, bring some type of little, I don't know, gift, whatever.
Yeah, yeah, yeah.
But I feel like I had this moment of like such defeat that they're still in the back of my car.
It's okay.
um,
They're
you
still
know,
there.
they are
They're
still
still there.
there.
You can do it. Yeah.
Yeah. I had this whole plan, but it's tough. It's tough when you just have such high hopes and it doesn't happen right away. And I try to remind myself it takes time. It takes time. Um, but I've experienced all types of emotions. I'm sure you can
I
imagine.
remember.
Like,
Yes.
am I good enough? Like, am I doing this right? And everything. So,
Both are yes, you are good enough and you are doing this right. Like, I think that, and I want to encourage you, like, taking insurance is not a bad thing. Like, you can have a successful practice, you can make good money taking insurance too, or you could convert back to cash, or you could take some cash patients. Like, all of it can work. That's why there's insurance practices that are like still open and working. Like both are good. It's not a negative thing and you just work with what you got, and I think that you're opening yourself up to being accessible to even more people. So when you visit, you could visit anywhere. Like you don't have to say, okay, I just have to visit cash therapists. Like you could, if there's a PCP that you drive by, you just drop your stuff off, you know, like literally anywhere. And I think that it's hard if you're like questioning yourself and your capabilities but I really do think like I think that if people just know you exist, they're gonna come. It's
Okay.
just a matter. I think right now it's just a matter of people not knowing that you're there.
Okay.
And that's just new businesses. That's just how new businesses are. Anyway, like there's nothing wrong with you that people weren't coming. Like I don't know any practice that had people just banging down their doors when they open. Like I've never heard it happening. Even practices that take every insurance possible. Like they still have to let people know that they're there.
Okay.
They still have to like whatever type of patient you want, like if you want more high acuity patients, you go talk to the local psych hospital and say, send them to me when they discharge. If you don't want people that are as acute, you go to therapist offices or primary care physicians. Like there's tons of primary care doctors that are providing psychiatric management and they're not as trained as we are. And they're kind of like, oh, where do I send this patient? You know?
One day I called a bunch of PCP offices in the area and I said, "What's your fax number?" to everyone.
Good.
And I faxed them. I have this letter that basically introducing myself to the area in my referral form, and I faxed that to them to like 30 something places. And
Good.
like 20 minutes, I get one call back. She said, "I have a stack of referrals." And I'm like, "Oh, 1 out of 35. Those are the numbers that I have to work with. So if
Sometimes
I
it
want
is.
three, I have to send out 100, you know?"
I think for a new practice, 100 connections is where you start. Like,
Okay,
no, that's a
minimum.
lot. I know that's a lot, but
Yeah.
it's like, okay, if you break it down, you contact 20 people a week for 5 weeks. You know, it
Okay.
feels a little less bad, but there are going to be people that don't get back to you. There's therapists that aren't even in practice anymore. There's PCP offices that like refuse to see anyone with a psych concern. You know, there's just going to be people that just don't even
Mm,
refer to you. That is incredible. Okay, so someone wrote back to you and said they have a stack of referrals. I love that. You might want to visit them in person, like if they're drivable,
yeah,
right?
yeah,
Whoever said that, just follow it up. Like, hey, I'm here. Drop off brochures, drop off cards, meet the office manager or whoever is giving patients referrals. You know, a lot of times if it's like one of those offices where the doctor's in the back and they're like tell the person in the front like, oh, give them psych referrals. You know, whoever that person is that called you, that is actually that's a huge success. So that person, because one practice can send you a bunch of patients, you
yeah,
know, they have
yeah,
the power to do that. PCP office, oh my God, their numbers are high, right?
yeah.
Like they see a lot of people. So okay, tell me more about this. I'm excited.